welcome to Liquid Biopsy Part 10 on types of circulating tumor cells and biomarkers, Vanathi's weekly educational innovation podcast to promote liquid biopsy to improve patients' quality of life. Circulating tumor cells CTC blood testing is used as a surrogate marker for cancer diagnosis, prognosis and therapy monitoring. Recently, cancer research has made advancement with many CTC clinical trial openings for different types of cancers. Drug testing innovations, including SFRP4 Wnt inhibitor for CTC line risk patients, are ongoing. The three major markers in CTC enrichment methods are epithelial-mesenchymal transition EMT and mesenchymal-epithelial transition MET. And when epithelial CTC lose their cell adhesion nature, it changes to the mesenchymal property. Expression of circulating tumor cells markers such as epithelial, that is EpCAM, and cytokeratin, the E-cadherin EMT invade the stroma and blood circulation. Epithelial EMT plus hybrid, EMT plus irreversible, and MET Vimentin, twist, fibronectin, N-cadherin, serpine, beta-catenin, circulating tumor stem cells, cancer stem cells, circulating hematopoietic stem cells, circulating endothelial progenitor cells, EPC, such as CD45, CD34, CD133, CD144, and CSCs, CD44, CD45, CD133 contribute to tumor development and progression and can predict patient outcome. The other major markers are CD47, PD-L1, ALDH, PSCA, PSA, EGFR, ER, HER2, survivin, PI3K alpha, and telomerase activity. They can be as single cells or in clusters. The most dangerous stem CTC or stem-like CTC medong therapeutic products are chemoresistant with EMT features associated with poor prognosis in metastatic cancers. The presence of circulating stem cells, endothelial progenitor cells, and cancer stem cells indicate the aggressiveness of cancer with a worse prognosis. We still need to understand CTC and sphere genomics. Although we have progressed with current EpCAM based detection technologies, it will result in non-epithelial CTC missed detection. Many preclinical academic lab models need to be revised for clinical translation. Clinicians and scientists should be trained to maintain the scientific integrity to do our job well in saving lives. During treatment evaluation, CTC as a non-invasive method will contribute to serial biopsies, avoiding frequent radiation exposure. Now, let's look at the status of these markers in different cancer types. Breast cancer CTC is well understood and studied with 2,850 publications on the global PubMed indexed platform written in English, indicating the advancement and research interest in the field. Researchers need identified as a single CTC, clusters and spheres with EpCAM, cytokeratin, CD133, CD24, CD44, ALDH1 and CD47, PLD1 and CEP8 expression. All three epithelial, MET, EMT phenotypes on prostate CTCs are identified, including prostate-specific membrane antigen PSMA and prostate-specific antigen PSA, ARVs, and FGF2. Around 2059 PubMed index search results written in English indicate the advancement and research interest in the field. On lung cancers, around 2050 PubMed indexed search results in English indicating the advancement and research interest in the field with EpCAM, CD45, CD14, Notch receptors, cytokeratin, CD45 and Vimentin expressions. On colorectal cancers, around 1020 PubMed publications reported on EpCAM, cytokeratin, EMT, microRNA and hybrid EMT markers expressions. On renal cancers, around 1040 publications reported on EpCAM, cytokeratin, Becklin, Vimentin, twist and PRL3 expressions. Around 960 PubMed publications on pancreatic cancer reported on Vimentin, EpCAM, cytokeratin, twist and PDSC expression. On hepatocellular carcinoma, around 860 publications reported with EpCAM, cytokeratin, Vimentin, twist and nano expressions. Lastly, with at least 290 publications reported on PubMed for head and neck cancer circulating tumor cells with EpCAM, cytokeratin as CTC counts, lines and stem cell spheres, including our proof of concept models for radiotherapy predictions. Next week, I will be covering radiotherapy CTC and biomarkers. Stay tuned for such an intellectual post. Thanks for watching.